Hi everybody. Today we are answering the question, why are spouse caregivers in worse health than the sick spouse they care for? Adult children helping an aging parent often don't realize the toll that caregiving takes on their mother or father who is caring for their other parent. The physical and emotional toll is even greater on spouse caregivers of persons with dementia. Add on to health problems and dementia the complexities of blended families as the result of second marriages or third marriages. The ability of these spouses to receive support from their biological children or stepchildren can be more challenging than one might think. I'll share some statistics about that. So, whether you are an adult child or a stepchild, aware that your mother or father is a caregiver for your other parent who may be your mother or father or your stepmother or father. Or maybe you are the spouse caregiver mixed up in all of this, and your health is significantly affected by care responsibilities. Stay with me. I'm going to share some statistics about spouse caregivers, dementia spouse caregivers, and what families can do about social support and looking at the loneliness of being a caregiver and how blended families can work through this. And whether you are the spouse or the adult child, how do you help with all of these issues that are happening? How can you help plan ahead, plan for today, help your parents work through these crazy situations? If this is your first time here, I'm Pamela D Wilson. I'm a caregiving expert, advocate, and speaker who helps adults and caregivers plan for and work through health, financial, legal aspects, navigating family relationships, everything that goes with managing caregiving and aging and health. You can learn more about me and my 20 plus years of professional experience by scrolling down below in the comment section below this video. You will find helpful links to my background, my website, a lot of free information on my website. Please also, I ask you, like this video, share my channel, comment, even if it's only to say thanks for the video. Your participation goes a long way in helping other people find their way here. Spousal caregiving. Being or becoming a spousal caregiver is no picnic. It's not easy. You spend your entire life with the love of your life, and then one day, one of you is diagnosed with one health condition, and then maybe another, and another, and another. Then add to this maybe dementia, maybe a life-affecting illness like cancer, multiple sclerosis, leukemia, or something else that just crops up out of the blue, was never expected. So what happens is your dreams of retirement and a happy future after you've worked so hard, saved money, raised children, maybe built a business, and pursued all these things you enjoyed, have just come to a crashing halt. And you're thinking, oh, what now? Spouses who care for each other, and caring for each other is really being married, right? I mean, if you're married, you're a caregiver. Maybe not yet for medical things, but you take care of the house, take care of the kids, make sure there's groceries, you do laundry. You're in this caring relationship. So spouses who care for each other during a marriage will fall into the role of possibly being the primary and only caregiver later in life. And this brings up a whole lot of worries. And worries can be even worse for spouses who divorced and remarried, and you have your children, and you've got stepchildren, and you're trying to figure out how are we going to manage all of this. So let's start by just background, a little bit of context. What is it like to be a spouse caregiver? Well, if you're the healthy spouse who is still working, you're juggling your job, 8 to 5, 9 to 5, and then you go home and you have your non-paid job of being a caregiver. You get to maybe organize medications, pay some doctor bills, help your spouse bathe, make dinner, do the laundry, a lot of things, right? And maybe your spouse used to help with some of these things and they no longer can. And so because you're working full-time and then you come home and you're working full-time and you never get a break, the caregiver spouse usually neglects their life, their health, and their well-being. What does this look like? Well, it looks like sleep deprivation. It looks like social isolation because you never get out of the house. You go to work to get out of the house, right? And you come home and you're stuck there because you have all these things to do. Spousal caregiving looks like depression. It looks like less physical activity because you don't get out of the house. Spousal caregiving can look like weight gain because you're stress eating and then you're mentally and physically exhausted all the time. So heaven forbid something else happens that you have to deal with. So for those of you who aren't in this space yet, think of how do you feel when you don't get a good night's sleep, right? Are you cranky, tired? Does your mind not work as well? Are you impatient? Don't feel well? Imagine the effect on your body if you never get a full night's sleep. This is how a spouse caregiver can feel, especially if they are caring for a husband or a wife who has dementia, who doesn't sleep through the night. They're up walking around all night and the caregiver is trying to listen to see, oh my God, have they fallen? Are they down in the kitchen? Are they walking out the front door? Spousal caregiving. It's exhausting. And spouses never complain, so who knows? Nobody knows except other spouse caregivers. While spouses want their spouses to do things to make them feel better and be healthy, they don't take their own advice. Spouse caregivers don't do whatever it takes for them to be healthy and feel better. They want their spouse to, but they don't take the same advice. You might feed your spouse really healthy food and make them take medications and all that kind of stuff. All the while you are just craving sweets and salty food to relieve the stress. Because stress makes people want to eat more. It makes people crave things. I mean, there are days, honestly, when I'm stressed and I just want to eat like a bag of cookies or something. I don't, but I recognize when I have that craving or that inclination, I'm like, oh my gosh, I must be stressed, right? Stress affects us in a lot of ways. So what happens when spousal caregivers don't get sleep? Maybe they're working full-time, they come home and they caregive, maybe they're a full-time caregiver. Well, all of this just piles up and up and up. Stress accumulates over time. Numbers like high blood pressure skyrockets, cholesterol, triglycerides, out of this world. Blood sugar rises. All of this stuff causes health issues, cardiovascular issues, other issues with the body. Caregivers get sick. And all of this stress affects the brain, especially when caregivers are uncertain about what's wrong with my husband. Is my husband okay today if I'm working? Is my wife at home okay? What's going on? A lot of uncertainty about how long am I going to be able to continue to work and my loved one be at home alone? When is the health of my loved one going to get worse? So there's a lot of worries and a lot of uncertainty. Again, stresses out Mr. Brain up here or Mrs. Brain up here. To the degree that there is research out there, spouse caregivers for spouses with dementia have a 15% higher rate of getting dementia themselves. This rate increases due to the length of the caregiving role, 5 years, 10 years, 15 years, 20 years, and because, guess what? The caregiver isn't taking care of themselves. They are in poor physical and emotional health. Now, this is an even more interesting one, but those of you who are spouse caregivers for people with dementia will recognize this because you tell me. The vocabulary of spouse caregivers of persons with dementia actually decreases because they use less of their mental skills and words in conversations with others. You know that if you are speaking to someone with dementia, you're not using a big vocabulary. You're keeping it as simple as possible. Time to eat. Time to go to bed. Drink this. Take this. Very simple. Because if you craft a long sentence, you get to the end of the sentence, your loved one doesn't remember the beginning of the sentence. Words, short sentences, simple, sweet. Let's talk about spouses who are solo caregivers, so they're doing it all by themselves. According to the Health and Retirement Study from the University of Michigan, this is a little bit of old data, but it probably hasn't changed too much, 2000 to 2014. 55% of spouses are doing it all themselves. No outside involvement whatsoever. God bless you. Only 36% of spouses receive support from others, and that could be an adult child or children. Maybe they pay for help, a family member, another friend shows up. Now, the statistics on caregivers who actually seek help, which means watch videos like this, take an education course, go to a support group, try to figure out how to be more healthy, less than 15 or 20%, which is why there are so many solo spouse caregivers out there. Your brain doesn't think you have time to go get help or information or joining a support group. I don't have time for that. I'm too busy. Family and social support, super important for managing health. It can bring down your blood pressure. It can calm you down. It can get rid of some of that anxiety and depression, because being a spouse caregiver without any support, or really any type of caregiver, adult, child, doesn't matter who you're caring for, being a caregiver with no support, a very lonely and isolating job. Add to this, family caregivers, adult children, spouses of people with dementia, they tell me that family members and friends just poof, they disappear into thin air. People who used to call and visit don't call and visit anymore. These disappearances shrink the world of caregivers and make them feel more isolated and more lonely. So even in these situations, if people are visiting less, calling less, as the caregiver, I do recommend you extend invitations and make time for you to get away with friends. Because requiring a friend to always come to your home because you're caring for a spouse might be unrealistic, especially if before you always used to go out and used to do things and be very active. People cannot always and may not always want to come to your house when that's not what you used to do before. Now, you think this is okay because your caregiver-care receiver relationship, right? It's now maybe a one-way street. It's not like both of you exchanging things. It's like I do everything, the person I care for receives everything. Well, relationships in life in general don't usually work that way. Or if they do, they don't work very long that way. Caregivers can't expect people outside of the immediate family or outside of the immediate circle to always come to them and call them and visit them. As a caregiver, you got to do your own outreach. You have to make time to call people, go out and do things. So this is an aspect of spousal caregiving or any type of caregiving that I really encourage people to be more open-minded about. Honestly, you'd be surprised how 2 hours out of the house or 4 hours out of the house can change your total outlook on life and the way that you think. The world may be a happier place just from getting away for a couple of hours a week. And then you have to realize, okay, you got your caregiving friends maybe, and then your other friends. Your friends may love you, but they don't want to talk about caregiving all the time. So maybe you need some separate friends, right? Think about women who have babies and how their relationships change, right? Mothers with children mainly spend time with other mothers who have children. They're not hanging around with their single friends who don't have kids. Single friends don't want to be around babies, maybe. And they're not hanging around with couples who don't have children. So because of life situations, interests and lifestyles change. Now, if you want to maintain those other relationships, you got to work at it. So for caregivers, you got two paths, right? Establish relationships with other caregivers where all you talk about is caregiving. Then work to maintain your friendships outside of caregiving. Because when you're no longer a caregiver, you're going to need these people. You're going to want these people in your life because you're going to totally want to get away from caregiving. You're going to want to forget that you did that for a while before your next caregiving relationship happens. Spending time with people outside of caregiving brings you back to the real world. What are people doing that actually have jobs? Helps you maintain a big vocabulary. You can actually talk to these people in big words that they understand. Gives you access to life experiences that you're not able to have right now. And gives you time to be with people who are maybe happy and less stressed and life is just good. The idea is not to envy their experiences, but to realize that your life can be that way in little bits and pieces. Maybe not totally right now, but little bits and pieces of your life that you can make happy and get away from caregiving. So much better for you. Now for the sick spouse, this is a little more difficult, especially if they are not mobile and they can't get out or they need really 24-hour supervision to be safe. So for a sick spouse, what the caregiver spouse can do is set up Zoom meetings with friends. A caregiver spouse can also bring in volunteers or maybe ask friends or people from your church or your social group to visit and schedule these visits on a regular basis. Now, admittedly, these visits are not really for the visitor. These visits are for your spouse. So what can these people give to your spouse? Can they read a book? Give you a break so you can leave? Watch a football game? Go through a photo album? Play a game of cards even though your loved one may not know what they're playing, right? What can they do to entertain your spouse and give you a break to leave the house? So the request for the visit may be less about, can you come spend some time with my spouse? It can be like, I really need a break. I would really appreciate it if you could just come to the house and just be at the house. Watch TV. I'll make lunch for you. Have lunch with, my spouse, my husband, my wife, whatever. But you're doing it for me, okay? I realize it might be hard for you, but can you just do this once a week, twice a month, whenever? Because what happens is family members who don't show up are probably having a lot of emotional difficulty with the health of your loved one, especially if they have dementia. Maybe they don't know how to talk to them, or they don't know how to react to repetitive behaviors, or they're afraid, oh my gosh, what if they have an accident? I don't know how to change, it depends. So family members can kind of disappear. Now let's talk about blended families. So while this family and friend shrinkage can happen because of health issues and not knowing how to respond to health issues and death and divorce and remarriage and maybe you move across the country, there are issues in blended families. Research shows that parents with only stepchildren, so maybe you were never married before, or maybe you were married and you never had kids, you get married and you marry somebody who has kids and those are your stepchildren. So parents with only stepchildren don't have as positive an experience when they need care. Why is that? Because those children are not theirs. Those children belong to your spouse. And maybe you don't have a good relationship with them. And maybe because you got married late, you haven't spent a lot of time with them. So when you think about relationships with parents and stepchildren, Unless parents and stepchildren spent a significant amount of time together, so maybe the remarriage was early and the kids were still young and in the house, unless there's that time together, there's really no relationship there, right? There's no obligation by you to be a parent to a stepchild who's 50 years old. There's no obligation by a stepchild who's 50 years old to take care of you. There's no unspoken agreement there. Because when you think about the time it takes to make a really good friend, and I think the number is over 400 hours, that's a lot of time, okay? If you remarried and your stepchildren are way across the country and maybe you see them every year for 24 hours for Christmas, 24 hours is not 400 hours. So unless you spend a lot of time with them and establish some kind of relationship, you and your remarried spouse need a better plan for your care. You need a plan that doesn't necessarily rely on the stepchildren, because the stepchildren may not step up, or they may step up, but your stepchildren who are on the other side are going to take care of the spouse, right? They're not necessarily going to take care of you. So a lot of unexpected things with blended families, which mean that spouses who remarried really need to make better plans for their care and not rely on their children. So let's now talk about the reality of spousal caregiving, the reality of being married. Usually spouses don't die on the same day, at the same time, in the same place. So in a perfect world, married couples would have conversations. They would make plans for what happens when one of us dies first. Okay? But we don't have these conversations. We don't have conversations about family caregiving in families. Taking it to this level is a whole nother level, right? Nobody wants to talk about this. Now, spouses in remarriages may be a little more realistic if they are remarried because their spouse died. Then they may be a little more comfortable about saying, I was a caregiver for my spouse for a long time. We're married now. One of us is going to be the caregiver. How do we see this going? How do we see this working out? What's the plan for whichever one of us outlives the other? So more statistics in general. 30% of caregivers die before the person that they care for. This is all caregivers, spouses, children, grandchildren, whoever. Specific to memory loss and Alzheimer's, 18% of spouses die before the spouse they care to. And this is data, again, the Health and Retirement Study. So if you're a caregiver for a spouse and they have a lot of health problems and you're doing a lot, you're probably going to worry about them. And you may worry that, the uncertainty of how much longer are they going to live? When are they going to die? That worry and uncertainty is bad for your mental health and your physical health. Now, caregivers also may worry about, how am I going to financially survive if my spouse passes away? My mother mentioned this to us as her children, and we never really answered her. We never really said, Mom, we'll take care of you. She would always say, I don't know how I'm going to live if your dad passes away first. I don't know how I'm going to pay the bills. He made all the money. I don't get that much from Social Security. Now, spouses can claim on a spouse's Social Security. I didn't know that back then, but I didn't comfort my mom. I didn't say, Mom, don't worry about it. We'll take care of you. I just heard her say this, and it kind of went in one ear and out the other, okay? If you hear your parents expressing these concerns, invite a conversation and say, well, what is your plan for that? Do you expect us to do something? What do you want? How can we help you work through this? So if you are in a spouse caregiving situation and money for care is a problem, if it will be a problem, start doing your research. Start investigating your state Medicaid program, which can also be called the single entry program. Find out what the qualifications are, because there may be things that you can do in advance to make sure that you qualify, to make sure that you'll be able to take care of yourself. And honestly, these topics, these questions, in my opinion, should be part of discussions when people start their estate plan, which is, who am I going to appoint as my medical power of attorney, my financial power of attorney, who's going to be the executor of my will or my trust. These should be like mandatory discussions that people have about who's going to be my caregiver, where am I going to receive care, how do I want to receive care, what if one of us dies first, how's the other one going to go on. We just don't talk about this. So if you're adult children watching all this happen with your parents, have a conversation with your spouse. Do you really want your spouse to get sick and maybe die from the stress of caring for you if you need a lot of care, or if you have a diagnosis of Alzheimer's or something else that requires 24-hour care? How much do you want your spouse to do for you? What do you really expect them to do? And vice versa, what does your spouse expect of you? Because while some level of dedication is expected, right? You get married, you agree to take care of each other. Well, there's eventually this line in the sand that gets crossed that becomes harmful not only to the caregiver's health, but potentially neglectful to the person who needs care, because that caregiver is burned out. They're exhausted. They can't take as good of care of you as you would like. Is that really what you want? Do you want harm to yourself, unintentional harm possibly, and harm to your spouse? And if you're a parent, do you really expect your children, and I know some parents do, to give up their lives and their career and not have children and put off going to school to take care of you? What can you do today to stay healthier so that you don't need care, to manage all the emotional stress that goes on up here? And while some family caregivers do give up everything to the detriment of their well-being, is that the model of behavior? Is that the pattern that you want to pass down to your kids and your grandkids, that, you know, this is just what we do no matter how miserable or sick it makes you? What if instead we started talking about caregiving when kids were young, and parents made plans for their own care that didn't necessarily mandate that their kids be those caregivers? What if we thought about this long before we needed to, and had conversations long before we needed to? I think life would look a lot different. But today, we're in the situation we're in. We could be a spousal caregiver in a miserable situation, in a very hard situation. We could be an adult child caregiver watching our parents go through this and care for each other and suffer and try to do as much as we can. But nobody can take another person's place. We can't always solve problems that other people created because they didn't take care of their health, or they didn't save money and plan. Now, if you are a millionaire or a billionaire, money can solve a lot of problems, but most of us are not in that place. So I encourage you, have family care conversations early. Have them often. Talk about the what ifs. Plan for the uncertainties and the unexpected situations that are sure to happen so that you have a plan and you're prepared. If you don't know how to do this, look below. There is a link to schedule a one-on-one consultation with me, and I'm happy to help. I help families all over the United States. I'm Pamela D Wilson, a caregiving expert, advocate, and speaker. Again, you can learn more about me below this video. Please do me a favor. Like this video, follow my channel, share it with other people, comment even if it's only to say, hey, thanks for the video. That little bit of participation from you helps so many other people find their way to this channel, to these videos, and to my website, PamelaDWilson.com. Have a fabulous rest of your day. I will see you all again soon in another video.